Hello, welcome to the SimHERA tutorial on the adult case 15003. Okay, great. In this tutorial what we're going to be doing is a walkthrough on how to do an electrophysiological test as well as some behavioral testing on an adult case with suspected retrocochlear pathology. So this case has already been created. This is a demonstration tutorial. And to navigate to get to the file where we can load it up, just go to the SimHERA website, list it up here, and we'll click on tutorials, and then case tutorials and videos can be found at this site. Click on that. That'll bring you up to this case tutorials website of SimHERA. And note, you can contribute to the public database if you're a student or other clinician. And we'll just quickly open that, and it is a Google Drive, and you can find cases for the assignments in open mode, and these things will be added through the community as well as myself. You can see under retrocochlear we have 2 cases already. There's 5001 and 15003. That's the one we're going to be working on today. So you can see the case file there, and you download it and load that up into SimHERA. But if you want a direct link to it, just go to any of these typical. We don't have yet. Conductive. These things will be coming as the database gets larger and larger. We're going to go to retrocochlear. There's the case 5001. But today we're going to be working on 15003. There's the case file. We're going to be generating a clinical report and a completed report as the SimHERA's data file, which is a .mat for MATLAB, as well as I'm going to be uploading this video that we're currently recording. So just simply click on that link and it'll bring you to a download, and you can download this. For brevity, I'm not going to waste the time watching the download spin. I've already downloaded it here. We have the case file situated on the desktop. Okay, so the next thing to do is to start up SimHERA and load up that case. So go to your applications, V33, and click on SimHERA 2021 V33. I'm on PC, so this is executable. If you're on your Mac, it'll be an app. Give that a minute to load, and then your password, enter your password. And then you'll see SimHERA pop up, starting SimHERA. Give it a minute or so to load. For SimHERA, this version, there is a little bit of a fix that we have to deal with here, and that is that SimHERA loads in an infant case, but we're going to be doing an adult case, and we need to set some parameters for SimHERA to work. So just for now, hit random adult case, hit continue, and it'll generate a new case. Yes, clear behavior. All right, now we're in kind of an adult mode. We can go ahead and load our case, which we can find under our desktop here, and there's case 15003. We go ahead and open that. It'll come up with a warning saying assignment number 1 was saved on the instructor version. I'm the instructor. I saved this as assignment number 1. Just go ahead and click OK. That's for you to know that if you're a student that you are getting the correct case. Great. And now we're into the case. In SimHERA, we're in the assignment number 1, adult, so we will not see any information about the case. However, this is a spoiler alert. We are going to turn on the instructor view. So therefore, we will end up seeing the case information. So if you want to run this tutorial and do it blindly where you do not see the case information, just like you would in a clinic, patient comes in, we do not know the audiogram. That's what we'll be assessing today, figuring out their thresholds as well as if they have any retrocochlear pathology. So if you want to do it on your own and then check how you performed, stop the video and come back after you've done that. Okay, so we'll take a look at that in a minute, and the case report is blank, and we're going to be doing some behavioral testing as well as some evoked response audiometry. So what we'll do now is we'll go into instructor mode, and here's the case information. So we have a patient with sloping loss and it is elevated more in the left than the right. So there's some asymmetry going on here. As you will note that there is also a wave 1 to 5 latency delay here. I'm actually just going to change this for the tutorial to make the behavior a little bit more reliable. But instructors, you can set that to whatever you like and save the case file. Okay. So first thing to do when patient comes in is you need to figure out a history. We already have a very rudimentary history here. So patient was referred from medical doctor after concern about hearing, no family history of elevated hearing thresholds, and no known risk factors. So we can go in, we can do tympanometry on this patient, and the patient is still quiet and asleep. We just wake them up in SimHERA. That will come up. It's in default as they are resting or asleep. And what I'm going to do here is just drag this to the right because I like to see the table results come up, which are shown on the case report here, while the TIMPs are being performed. So we'll do a right ear tympanogram, and it shows up here on the case report with the values. And we'll say that's type A. We don't have otoscopy in this version of SimHERA, but we'll just say we did it and it's clear. And then we'll do a left ear TIMP. And there we have it there. And we'll still say type A. Okay, we can also do acoustic reflexes. So we'll do a right ear IPSI for demonstration. We'll do 500 and 1,000. Your instructors may ask you to go more in depth and more in detail and do other frequencies as well. So I'm seeing that was about 90. Yep, 90 at 500 and right. So we just put that into our table, and we will go and then do, I'll just do 500 and 2,000 for demonstration purposes here. And one at 90 there too. So we can go 90 dB. And then we'll switch to the left ear. And there's a reflex there, 500 left ear IPSI at 90. And then do that again for 2,000. And again, 90 for that. 2,000 left ear. We can also do left ear contra, right ear contra. For today's demo, I'm just going to leave those out. But what we'll do is a left ear decay function as well as a right ear. And what we're looking for is if this reflex can be sustained across the stimulus duration, but if it falls less than 50% of the overall amplitude before that time, that will be a positive sign for a reflex decay. So we'll put that into the chart here for the 2K, and let's go on and see what the right ear decay looks like. And so that looked like it sustained throughout the duration, so we'll say that's a negative sign or a negative decay test. And again, your clinical educator, your instructor might want you to fill in all of this information. For the sake of this video, we're just going to keep it as this as a demonstration. We're going to move on to DPOEs, and we can do our DPOEs in the right ear, and they will show up at the same time on the case report. Once the DP-gram is created, it will then show you the values in these columns and whether or not there was a response detected at those frequencies. So we can see the DP-gram looking like it's falling within normal limits of the shaded region, and it's above the noise floor which is the colored red shaded area. And yes, response detected in all those frequencies. Let's go on to do the left ear. And again, response present in the left ear for those frequencies. So this is starting to look like, yes, likely retrocochlear. Let's go and do the behavior to figure out their pure tone thresholds, and then evoked response audiometry. So we'll just click and drag that patient over to here. If you'd like to reset it to original view, right-click on that button and click yes, and it resets it to this perspective. Okay, we're going to do behavioral audiometry. Now, I'm just going to select inserts here, and because we have the instructor view on, we're also going to plot the psychometric curve and show the test data. So the audiograms on the right will disappear, but the test data will show the trial by trial testing. I'm only going to demonstrate this in this kind of live tutorial for the 1000 hertz air conducted left ear and bone conducted left ear. And then I will do the rest of the behavior, speed up the video to shorten the whole video tutorial, and then I'll come back and we will revisit the information and then move on to evoked response audiometry. Okay, so let's get started with the 1000 hertz AC left ear, and I'm just going to put in stimulus playback on, and this is a safety warning. Make sure that your headphones are at a comfortable listening level and they don't exceed the safety limits. For more information, you can see the website, the ASHA website. That'll pop up every time just as a reminder to protect your hearing when you're using SimHERA to do your testing. And it automatically saved the report there. I'm just going to turn this off for the video. I recommend that you keep it on 5 or 10 minutes. Okay, so I'm going to be following ASHA's guidelines loosely. I'm obviously not going to follow the frequency order because I'm just going to be showing you the 1000 hertz AC and BC, and then we'll move on to doing the testing as a speed up video. So in SimHERA, what we do is you can change it here. You can also go up and down with your buttons. I've got playback for my setting about 60 dB, sounds about right given 50% on my microphone and speaker setting. And we have inserts in. You could use a warble, but we're going to use pure tone for this case, and we're just going to present at 30 dB. Oh, and don't forget to click Start Session. Yes, clear. We're starting a new patient, new session. All right, here we go and present. And you see the VU meter change here, and the patient raised their hand. So clearly you could hear that. What I'm going to do now is turn that down to hopefully a sub-threshold or very near threshold. So we'll go 0 dB and see if the patient can hear this. And no response. And I have to go back into instructor view. I just noticed that the trial by trial isn't showing up. And that is because when it saves it, it automatically reverts back to the assignment mode only. Okay, so the first presentation we did was at 30 dB. We have that asterisk there, and response was given, so it's a blue, and then we went down to 0, no response. So then we go up 5 dB, and response present. And you can see that on the psychometric curve here as well. The green-blue circle here. So we get response present, go down 10 dB, no response, up 5, no response, up 5, no response, up 5. Response, we still don't have 2 out of 3, So we go down 10, response present, and that's not 2 out of 3, so go down 10, no response, up 5, up 5, up 5, we got a response present, and there are 2 out of 3 response present at that. We click store, and it stores it right here. So 5 dB. If you want to check the audiogram, just click on this button back, and you see a nice X right there for left ear, 1000 Hertz, 5 dB. Okay, so I'm going to move on. I'm going to obviously not follow ASHA's guidelines, and I'm going to move on just to show you for bone conduction what we can do. We're going to do left bone conduction, and depending on your clinical educator, your instructor, they might suggest that you always put in masking. So you click here, narrowband masking, and depending on what they set it to, I'm going to set it at 60. There is narrowband masking in your left ear, which is the patient's right ear. So we're making this patient-centric. And then we're going to go ahead and present our tones through the bone conductor. See how the patient responds. So response present, go down 10 dB. No response, up 5. Up 5. Response, and we've got 2 out of 2. So we'll hit store there. Right, and we see the masked bone symbol there, and we go back to the audiogram, and we have that same thing here. So this is how we can do behavioral testing in Simba alongside SimHERA. We're going to go and finish this behavioral testing at fast speed, rapid speed, and then we'll come back and show you the results. Now that the pure tone behavioral thresholds have been collected, we can see in the left ear there's an elevation starting above 2 kilohertz and a little bit of a sloping loss potentially for the right ear. If we just go back to the case, we can see that overlaid here, and there's a little bit of an asymmetry between the left and the right. So we're going to move on and do our evoked responses. So the first thing we need to do is set up the patient. So I'm just going to go into evoked responses. turn on the EEG because I like watching this as we set up the patient. So go back to setting up the patient, turn off that panel, and we need to start doing some prep. I'm going to do this in the 2D head. You can use 3D head, but on slower computers or low-end graphics, that might not be as usable. So we'll just go ahead and start prepping. Click on an alcohol pad, and then we'll go to our prep pad, give it a little rub, and then set our ground. And then we'll do that the same for the vertex. We'll go to the top, and we'll just do a little alcohol, a little prep pad, and then we stick on our vertex. All right, then we'll move to the right, and same procedure. A little lower on the mastoid there. Make room for the bone oscillator, and then we will put our right in. Move to the left, and then same thing. Oh, and I rubbed a little bit too much, and the patient got a little upset and went, "Arg, that hurts." And when you put the electrode on, they might do the same. So if your EEG doesn't update, now it's updating, and we can see that if I were to pull the electrode off, we get a lot more noise in that blue channel, which is the left mastoid, and then back on. Okay, so we're all around 2, which is excellent, and they're all equal, so lower than 3 and pretty much equal. So we've done a pretty good job prepping the patient. Just going to go back to front view, and the next thing to do is insert your earphones. Make sure that they are seated and in. SimHERA does simulate real-life situations where sometimes they will fall out. So it's good to check back once in a while just to make sure that they are also in. Okay, so now that we've got our patient set up, the patient's a little noisy here, but it's probably because they're awake, so we have to say, let's go back to sleep. And patient is not able to sleep. This can happen sometimes. Just say, hey, let's see if you can get back to sleep. Oh, and there we go. Patient was able to get to sleep, and you can see the EEG got fairly quiet there. Okay, so let's move on to do the evoked response audiometry. Here we are in the evoked response panel. The EEG is reasonably quiet. We'll just reduce the artifact rejection limits because if the patient does wake up, we won't then be collecting just noise. And then we're going to follow our procedures for testing. I'm going to first do the acquire on the left ear because we know from their audiogram that we just did that the left ear has the most elevated thresholds. So that's the one we start with. And we are going to do this online in the left ear, and then for sake of brevity, I will then do it offline recordings in the right ear. So let's go and select rare, 19.1 per second. Depending on your clinic, you might start at 90 or 80. We're going to go ahead and do 80 here. And note that in this SimHERA version, that anytime you change this frequency, the filtering defaults back to 30 to 3000, so you have to change that every time. The newer versions will have that reset to 1500 for doing clicks. All right, so 80 rare, 19.1 left ear. EEG looks reasonably good, and we can end up then showing also the stats online, and we'll hit acquire here. So on the left here, these are the standard deviation ratio and FSP. If you're using IHS, we can shift that to IHS and show the SNR value. That would also change this RN value here. So we'll go back and we'll change that to SDR and FSP if you like FSP. And FSP is already showing that there's a response present in this recording, and the SDR is getting close to that dotted line, which is the criteria for that statistic. And you can see this is the p-value statistic and criteria and dotted lines. Okay, there's our first recording. I'm just going to turn stats off for here, and we'll do our second recording. You can click and drag these waveforms while it's recording, but don't hold and drag it for a bit. That will hang your computer. And I've got a fairly fast graphics card on this computer, so the graphics card can handle that, moving it around. But we have noted in the past on lower end graphics that clicking and dragging these things while the recording is ongoing can be problematic. If you're on a slower computer, you can also change this update time to every 4 seconds. So it updates every 4, as well as you can turn off the EEG, turn on and off. You can change that also to a longer update time. I'm going to change this back to 2 seconds for my computer. But you can see here we have recordings for 2 reps. Looks like wave 1, kind of like another replication there for that wave 1. Wave 5, if this is truly wave 5, again, a little bit off in peak where we would select that peak. So it's good to do another recording here. Now, I do know from my computer that if I change this to 0.5, it will have a more rapid updating. Sometimes what you'll see, kind of that rapid updating in the clinic. So just go ahead and play with that depending on your computer speed and graphics card. So now I'm kind of seeing this more wave 1 replicating a bit better, and then the peak here at wave 5 again replicating. So we're probably good to go with 3 replications for rare when it finishes. And there we have it. We'll just do a quick average, select them all, hit average. Yep, there you can probably feel confident that that's wave 1, and this is likely a wave 5, but we need to go and do our condensation clicks. So here we're going to change it back to 80, and again we have to go up in the right and change the filter settings to 1500. So for me, I simply clear that and then replot it so that the plot for the rare is down here at the bottom, and we can then do our condensation next. So we're trying to look for that 4-5 split. This actually could be a wave 4 here that we're seeing as being more prominent in the condensation. Let's do another recording for cond to see whether or not this is 4-5. So this could be wave 1, wave 2, wave 3, and that could be a 4-5 here. This is the importance of doing the condensation, because we really want to be sure that this is wave 5 and not wave 4, and that this is not wave 5. Or maybe that's wave 5 and this is wave 6, and this is a truncated wave 5. So we have to figure out where or when wave 5 is occurring, because we're wanting to pick that wave 1 to 5 interval. That is our more sensitive and specific tests for screening for retrocochlear pathology. So this is looking like it's fitting maybe a wave 4. This isn't quite replicating very well, and the peak on this, not bad for wave 1, but some clinicians might stop. I'm going to just do one more recording to feel quite confident that this is a wave 4 and 5 complex here. And then we can generate our alternating. Typically what we will do after we do our condensation recordings, we'll quickly go over and start testing the right ear. And be doing our analysis or additions and averaging of our cons and our rares while it's recording. But for the sake of this demonstration, I'm going to keep it focused and attention on just doing the left ear, doing the averaging, and then I'll move on to the right ear. Okay, so now the wave 4 is replicating a lot better here, and then wave 5 here, so there was some noise coming in on this replication here. Okay, so we can kind of stop there and we can do an average of the condensation, and yeah, that's feeling nice where we have wave 1, this might be a 2, maybe that's the 2 and that's the 3, this looks like a 4-5 complex here. So I can feel fairly confident that we've separated 4 and 5 and that this is wave 5 here. So I'm just going to make the scale a little bit larger. Let's try 2.5. Try to look at these waveforms when you're doing your recordings at lower, like a zoomed up scale. And also we're going to put this all on page 1. So let's go and replot this on page 1. And if you note the scale changes here, what you can do is just go back to the acquire page and hit apply all, and that will reset the scale here. And then just go ahead, clear and plot that, and then bang, everything's all plotted out again. Now we're going to have to click and drag these up. So we've got our replications of rare here. We got 3 reps of rare, 3 reps of cond, and there's our average rare, rep cond, rep of cond, and our average of cond. Now for creating alternating, we're going to add our rare and our cond. Now if we had unequal number of sweeps in our rarefaction and our condensation, we're going to need to do what's called an averaging of microvolt weighting, not sweeps weighting. How we do that in SimHERA is this little button here. We click to average microvolts. Because we have the same number of sweeps in both rare and cond, we don't have to worry about it. It'll be the same whether you do average microvolt or average sweeps. I'm going to keep it as average microvolt because that's commonly what we do, regardless of the number of sweeps that are in here. So let's go and select both of these, and we're going to go average. Okay, so we have our average of our rare and our con, and it's equal, so we have 6,000 sweeps in the alternating. Now an easy way in SimHERA to make 2 replications of this is just to take that average and split buffers. So you have buffer 1, which is 3,000, and if we selected the right one, yep, Alt, there's buffer 2 for the other split. And we can see the replication of wave 1. There's possibly a 2, 3 in here, wave 4, and wave 5. So then we can go ahead and do our markings on our average. Click wave 1, that looks about right for the peak, and wave 5 is the one of absolute concern, so we can do a quick little check to see whether or not this is within our norms. And 5.56 is well outside of our norms of 4.52 or more, maybe 4.58, depending on which norms you use, the Stockwell, the Chiappa, or the Campbell norms. But for our norms we have, this is definitely outside our normative values, so this would be abnormal. And then we would label this wave 4. It's kind of hard to see whether this is wave 2 or not, but I like to have the wave 4 designated so we can clearly define that this is wave 5. Okay. So a nice thing to do for others and as well as yourself is put in a title. So we go click ABR and then note here wave 1 to 5. Interpeak latency equals 5.56 milliseconds, which implies that it is abnormal. And now when you're reviewing this and you create your case report, it will be clear to anyone that this is abnormal. Click ABR, likely determining that we have a retrocochlear pathology here. You can also click on this waveform and put on a text, and you could also put in wave 1 to 5, IPL equals 5.56 milliseconds as well. Okay, so we've done that for alternating. It's also nice to label your waves for your rares and your cons, just so you're clearly defining why you've labeled these on the alternating. So 5, I guess given this we could call that a 4, and wave 1 here. If you're so inclined, we could label this wave 2. It's either this peak, maybe that peak. It's kind of hard to define. For our purposes, we are looking at the 1 to 5 intervals, so it's not critical for us to be picking these peaks. But if you were, let's say that's peak 3, just for demonstration purposes. Maybe if you're thinking this is wave 3, we can mark this wave 3, and also maybe that little shoulder there is wave 2. All right, so we got a definite delay in 1 to 5 in the left ear. So what I'm going to do now is I'm going to go to offline and collect those for the right ear. We'll go back to the acquire page. I'm just going to clear that, and then we'll go offline. We'll go start with rarefaction, right ear, 80, and change our filter settings to 1500. All right. Everything looks good. Go back, check the patient, inserts are in, and electrodes look fine, EEG looks fine, and we will go ahead and click acquire. We got 2 recordings. This wave 1 doesn't look that pretty, so we'll do another one. And we'll take a look, see if the average comes out a little bit better. Now keep in mind our scale is pretty high, so it's better to look at these. If they go off screen, just simply clear that and replot. So I like looking at this at a scale of 1.5 microvolts here. And so now this becomes a little bit more obvious. There's wave 1, wave 3, that might be a 4-5 complex here. Okay. So I'm feeling comfortable with that likely being wave 1. So I'm going to move on, and we're going to do a condensation, and gain, change intensity, and filter settings. And right, oopsie, we'll have another recording. So there's a cond, other cond, large amount of noise going on there. We'll need another recording. Wow. That's not really replicating too well for wave 1. Let's see what the average is looking a little bit better, but it's kind of hard to distinguish whether or not that's wave 1. It's looking that way, and yeah, when you overlay these two, there we go, there's wave 1. That's probably a wave 2 shoulder and wave 3, and then a 4-5 together. Now this doesn't have a clearly defined 4-5, so to be able to distinguish whether this is 4 and maybe that's 5, there could be a delay here going on between 4 and 5, we can increase the rate as another technique. Okay. So what I'm going to do is go and plot these over on page 1. And there's a cond average, rare average, and then we'll move these things into the right positions. Okay, so let's label this 1. This is a 3. We're unsure about the 5 there, so I'm just going to not label that right now. And we'll come back to that because we're going to go to a faster rate. So let's go back to the acquire page. I'm just going to clear that, and I'm going to replot the rare and conned averages. This could be a 4 with a 5 added, or that's a 5, this is a 4. But we're unsure, so the thing we can do is just go at a faster rate. Let's go 80.1 per second, and this should drop the wave 4 amplitude and keep in wave 5. So there's one replication. Oh, and the patient got a little noisy and exceeded our rejection limits. That's why we have this. Maybe they're a little tight, so I'm just going to go ahead and clear that wave. And we can actually just go ahead and delete that. Okay, and we'll do another replication here. There we go. Okay, so this is pretty much wave 5. Take the average of that, and it's matching up with this edge here. So there is a 4 in here and a 5. So I can feel comfortable that we've got a 4-5 complex, and we'll be marking that as wave 5. So let's go back, and actually we'll go to page 2 and plot these out on page 2 to say faster rate to confirm wave 5. Add that as a title, faster rate to confirm wave 5 latency. And we'll mark this as 5. And we can plot up our 2 rare and cons. And there is a delay because it's being presented at a faster rate. So there is a bit of a delay here, but that is definitely 5. So then we can also put on here text. This was presented at 80.1 per second. And we can label that here. And these ones we can label as 19.1 per second. $19.1 per second for this one too, just to clearly define our conditions. And then that's wave 5. So when we're reviewing this again, we can feel confident in why we chose that as wave 5 latency. So let's go back to page 1. Now we can replot the wave 5 here, select this, and go wave 5, and then we can do our averaging. So this is where we have more sweeps within the average for our condensation than rare, so we definitely want to do microvolt averaging here. And that's already been selected, and then here is our alt average. And again, now when we split the buffers, we have 7,000 sweeps, 4,000 conned, 3,000 rare. But when we split them, it splits equally. So we'll go split buffer. And now we've got our 2 reps of 3,500 for our alternating. Now we'll label this as wave 1 here, and wave 3. And our wave 5 right on that shoulder corner that lines up. It's probably a little over. There we go. There we go. And now we have our 1 to 5 for our right ear. 3.66. So definitely within normal limits. I just went to click title, Control C, just to help myself out. And then Control V, 3.66 milliseconds. And we would say within normal limits, and click OK. We can also add this text, say wave 125 interpeak latency equals 3.66 milliseconds. You can add that down here. So now it becomes quite clear of what this is referring to. So we've successfully done our click evoked ABR for screening retrocochlear pathology. Left ear, we have abnormal 1 to 5 interpeak latency, and right ear, we have a within normal limit 1 to 5 interpeak latency. So we've done our collection. Now we need to go and report these back on the case report. So under evoked responses up here, results, we have neurological, left ear, right ear. We can type them in there. I find the easiest way to do that is just to repeat what we put on to the waveform printouts. Click on Add Title, Control C, hit Cancel there, and then Control V. Okay, if you're using Apple, it's Apple C and Apple Command C and Apple Command V. And then we'll just do that same thing for the right here. Control C and Control V. Okay, so now we've got our response results. We didn't do thresholds, so we'll leave those blank as did not test. And then we can go ahead and type our summary here. And for the sake of brevity, I just typed it out and we're seeing it here. So results indicated atypical hearing based on mild, moderate, elevated pure tone behavioral thresholds, delayed neural conduction between 8th nerve and auditory brainstem pathways due to delayed wave 1 to 5 interpeak latency, and positive acoustic reflex decay. Present DPOAs from 1 to 6 kHz indicated typical functioning of outer hair cells, middle ear compliance was within normal limits, and otoscopy was clear. For the right ear, pure tone behavioral results indicated a mild elevated threshold at 8 kHz. All other results indicated typical hearing. So then we could go on and say our recommendations maybe refer to ENT for further interpretation and discussion regarding the atypical results and elevated hearing in the left ear. Great. So we've created our report. We have our behavior results, OAEs, tympanometry, some acoustic reflexes. You could fill that in again if you like. Our evoked response results for the click ABR, the neurological ABR. Didn't test the thresholds. Our summary, and our recommendations. Now let's check to make sure everything is what we want it to be. We have our case report here. We've done our behavioral and then our evoked responses. Now it's going to plot out any page that has data on it. The acquire page, what I like to do is just leave it blank, so we clear it all, and then we go and check our page 1. Yes, it's got a title. It's got what we want it to look like, with all our waves plotted out. And then our page 2, yes, faster rate to confirm wave 5 latency. Excellent. And then we can go ahead and save our results. So we'll go in here and we'll go save case, and we'll save it as this 15003. Report completed. SimHERA was version 33D. Hit save. I've already saved this once, so we'll save it again. It might take a minute or so to save. So just give it some time here. There we go, got it saved. The next thing to do is save the actual report. It's going to save the case report and any page that has a plot, like I said, for the evoked response. So we'll go save report, and I've already saved it once, but we'll save it again. Case report, SimHERA V33, go save here. Replace it, yes. Enter your name, Tony Herdman, and student number if applicable. And then please read the screen, print a case report. Do not move or click the SimHERA until the printing is completed. And just please wait, be patient. And there it is, case report printed. So let's take a look at what the case report looks like. So it opened up on my other screen here, and here's the case report. It's in a PDF, SimHERA Case Report, page NHS, ID 15003. It was done in the assignment number 1, adult, and was saved. The original was created on the instructor version, and the report is by my client ID, Eve, and my name, Tony Herdman, student number. Not applicable. And then the next page down has the patient report. As we can see, the history, all of the audiogram information, OEs, TIMPs, reflexes, and what we put in for evoke response, our summary, and our recommendations. And then the next page will be the next page in the order, page 1, where we have the click ABR for the left ear, and then the right ear on the right, and all of the labels. And then the second page, which has that faster rate to confirm wave 5 latency. So there's the report. You can then email that to your instructor or keep it on file for you for reviewing for later. And if you are the instructor, what you can do is take a look and see how well the student did, or how well you did if you're practicing yourself, is that you can turn your instructor view on, and then you can go back to your waveforms and click on them, and then change it to data plus signal. And hit replot, and that shows now this is wave 1, there's a 4 and a 5. You can clearly see the actual signal without the noise. And we can do that again also for here, for this one, and it looks like we were slightly off with picking that wave 1 latency. So if we take a look at that, we can see the wave 1 interval here we had 1 to 5 was 3.66. If we take a look back at the actual interval, for the cases is 3.78. So we're off by 0.1, not a critical amount, but it is a little bit off, but that's what happens when we get a little bit of noise. So we can actually get to the truth behind what is in the signal without the noise when we're doing this kind of plotting of signal plus data, or just the signal. If you're in open mode doing this, you'd be able to check back and see your ABR wave latencies as well as your behavioral information. So this concludes the tutorial walkthrough on how to do evoked response audiometry and behavioral audiometry on the case 15003. I hope you enjoyed watching this tutorial. Have fun learning, and I'll see you next time.